Us by telephone. It's our good friend, the author of the New York Times bestseller, The Obamacare Survival Guide, Nick Tate.
How you doing, Nick?
I'm all right. Hey, JD. Hey, Miranda. What's going on?
Well, pal, we're just trying to get, we just heard this weekend from the Secretary of Health and Human Services how great this weekend was for signing up for Obamacare. Chances are you've probably taken a look at the website. Are there improvements, in fact?
Well, in fact, there are a couple things that are better this time around than last time. You spend $400 million, you're going to see some benefits. But the question is, are we going to see people signing up this year? The expectation, and even the expectations from the White House, are that fewer people are going to sign up than were projected even a few months ago because of all the problems last year. There is one new improvement that is worth mentioning, and that is that you can now go to the website and window shop without actually having to provide a great deal of information. That was a problem last year. That was why a lot of people couldn't get on. So at this point, you really can just take a look and not have to commit. The question is how many folks are actually going to do that.
Well, Nick, we've talked before about this. A lot of Republicans are still threatening to repeal Obamacare. Do you think that's going to happen?
I think there's a great opportunity for Republicans to make change, yes. My expectation, based on the experts that I'm talking to, is that we are going to get a vote in the new Congress early in the year for a full repeal of the Affordable Care Act. That's largely to give the new members of Congress a chance to get on the record and vote to repeal it, rip it out, root and branch, as Mitch McConnell likes to say. But as we know, the president is almost certainly going to veto any repeal effort like that. So what I think what will then happen is we'll see a series of targeted steps that make changes to the law in a kind of piecemeal fashion. I think you can do that. I think the Congress can do that without just nibbling around the edges. They may be able to change the employer mandate, which kicks in January 1. They're likely to repeal the medical device tax that kicks in this year. And they're also likely to make some big changes in Medicaid and giving states better opportunities to privatize and do more cost-saving measures in improving Medicaid. So I think we are going to see some real change. We'll probably get that repeal vote, but I don't know whether that will actually pass the president's desk. But I do think we're going to get change early in the year.
Well, Nick, as we take a look at this politically, the atmospherics continue to perhaps brand Obamacare as a terminal public policy. I mean, the new Gallup poll shows approval for this health law is at an all-time low. In fact, see it right here on our parent website, Newsmax.com. And as the deputy editor of our health coverage from Newsmax, when the public sours on something the way the public has soured on Obamacare, is there any way that people will somehow flock back to the notion of government being a key agent of change in the healthcare markets?
Well, I think that's why we saw the Republicans do so well in the midterms. I really believe that vote was a referendum on Obamacare. I believe there were a lot of Republicans that were campaigning on the idea that Obamacare would be repealed, and now I think the Republicans have to deliver on those promises. If they can't, if the new Congress can't get a wholesale repeal, I think they're going to have to make changes in a piecemeal fashion. But I do think that that's what's driving it, is that voter dissatisfaction with the way this law has been rolled out, the lies that were told at the beginning, and people are paying more for health insurance. Anytime you hit the pocketbook on an issue like health care, the voters are not going to be happy. And as a healthcare journalist, for me, the question has always been, how is it going to impact consumers? And for a lot of Americans, this has not been a very good thing.
See, that's so interesting to hear you say that, Nick, because I actually met a gentleman over the weekend that said, I asked him what he does for a living, and he says, I actually sell Obamacare. And he said, this is on his opinion, that he thought it was actually a good thing because it was making insurance companies more competitive and would bring costs down to consumers. What are your thoughts on that? Because you're saying quite the opposite.
Well, here's someone who may have a vested interest, Miranda.
Right. No, I mean, of course.
Listen, Obamacare has been good for a number of people. It has not been a bad thing for the insurance companies. They have millions of new clients who are being delivered to their doors because the law requires everyone to have insurance. Make no mistake, there are some people who've been helped. If you have a pre-existing condition, there are new protections for you. If you're low income, you're getting subsidies. You're getting help paying off those health insurance premiums. So there are some folks, millions of people, who have been helped by Obamacare, and that's why I think a kind of measured approach to reforming this law by the Republican Congress can make an impact by preserving those things that are working for folks. If you have a pre-existing condition, for instance, getting subsidies if you need them to buy your health insurance, to pay off that premium. But there are other things that are more onerous that could be stopped, like the employer mandate, which is causing employers to drop health insurance for millions of Americans and will continue to do so. That's one example. The Medicaid costs that are just skyrocketing and eating up many states' budgets. Those are things that need to be and can be addressed while also preserving some of the things that people do seem to like. And if you look at the proposals that the Republicans have introduced in Congress, in the Senate and the House, many of those aspects are actually preserved. The pre-existing conditions and some of the other benefits to folks, they are not done away with by the Republican plans, but the Republicans do need to make some changes in those things that have yet to take effect. It could have a definite negative effect, not only on workers, but Americans and employers.
Nick, about 30 seconds. We need your assessment on what has turned out to be a pre-existing political condition for Obamacare. The architect of the program, Jonathan Gruber, and his comments. How dangerous is that for any type of continuance of Obamacare?
Well, I think it's more evidence that, in fact, this law was sold largely on a series of mistruths. You can keep your health insurance if you like it. You can keep your doctor if you like it. Your health care costs are going to go down by $2,500 a year. Those are things we all heard the president say, not just a consultant. So this is just one more piece of evidence that what was used in terms of politicking to sell this law turned out not to be true. I think it gives more strength to those who would like to reform the law.
Nick Tate, Deputy Editor, Newsmax Health, and also the author of the best-selling Obamacare Survival Guide. Thanks so much for your time. We continue on here as we talk about the possible affliction of executive-inflicted amnesty. That and more coming up on America's